Welcome to EQBloom. Today we're diving into a topic that confuses millions, the subtle but important difference between burnout and depression. On the surface, they can look almost identical: exhaustion, lack of motivation, emotional numbness. What if I told you that beneath that similarity lie two distinct brain states, with different origins, mechanisms, and healing paths? This slide visually introduces that idea. Notice a split face, one side looking drained and overworked, the other looking sad and emotionally heavy. Between them is a brain icon with a question mark, signaling our core question: what's really going on in the brain when we feel this way? Today we'll explore what burnout really is, how it differs neurologically from depression, and why knowing the distinction can change how we approach healing. We'll cover the brain imaging studies, neurotransmitter shifts, and personalized recovery strategies, all backed up by neuroscience. Let's begin. Burnout is not simply feeling tired. It's a chronic condition rooted in prolonged, unrelenting stress, most often related to work, school, or caregiving. Here we see a cluttered desk, ticking clock, and stacks of work. The imagery captures that persistent overload we associate with burnout. You're showing up every day, but your internal resources are wearing thin. On a neurological level, burnout is marked by hyperactivation in the prefrontal cortex. That's the brain region responsible for planning, focus, and executive function. Think of it as a CEO who's working double shifts with no breaks. The neurons don't shut down, they just fire inefficiently. You're thinking, but you're foggy. You care, but you're numb. It's not apathy, it's depletion. What's most deceptive about burnout is that it often masks itself as laziness or incompetence, when in reality it's the result of unsustainable output without recovery. This makes early recognition and validation absolutely crucial. Now let's pivot to depression. This slide shows a person curled up in bed, surrounded by fog, a visual metaphor for the emotional heaviness and mental slowness that define depressive states. Unlike burnout, where the brain is overworking inefficiently, depression features widespread underactivity, especially in the limbic system, and reward pathways like the nucleus accumbens. Neurotransmitters like serotonin and dopamine, which regulate mood, motivation, and pleasure, are often dysregulated or diminished. In short, depression isn't just a response to stress. It's a shift in how the brain processes reward, connection, and emotion. That's why people with depression often experience anhedonia, the inability to feel pressure, along with sleep disruption, appetite changes, guilt, and loss of purpose. It's not about trying hard enough, it's about a brain that's operating in a different neurochemical landscape. Let's now look at these two states side by side. On the left, we have the burnout brain, hyperactive prefrontal cortex, struggling to stay organized under continuous pressure. On the right, we see the depression brain, hypoactive limbic regions with flattened motivation and dampened reward signaling. This distinction is crucial. Burnout is about overactivation of control systems. Depression is about underactivation of emotional circuits. One feels like spinning your wheels and getting nowhere. The other feels like not even having wheels to begin with. But here's the catch. If burnout is left untreated, it can collapse into depression. When the brain remains in prolonged overload, it eventually gives up trying and reward circuits begin to shut down. This is why early intervention in burnout is so vital, not just for performance, but for mental health. Now we reach the most confusing part, the overlap. This Venn diagram shows that both burnout and depression can share symptoms like fatigue, poor concentration, low motivation, and emotional detachment, but their roots are different. Burnout stems from external demands exceeding capacity. Depression often emerges from internal dysregulation, even without an obvious trigger. Why does this matter? Because mislabeling one as the other can delay or derail recovery. For example, someone burned out may be prescribed antidepressants when what they need is time off and structural change, or a clinically depressed individual may just be told to set boundaries when their brain chemistry needs deeper support. We must be cautious not to medicalize all exhaustion, but to also not minimize true depression. Here's where science meets strategy. This slide is a toolbox, representing targeted interventions based on root cause. If you're dealing with burnout, the most effective solutions can involve changing your inputs, adjusting workloads, setting boundaries, taking real breaks, or redesigning your daily structure. The goal is to calm the overloaded prefrontal cortex to give the thinking brain space to recover. For depression, however, interventions often target internal regulations, SSRIs or SNRIs, to adjust serotonin levels, cognitive behavioral therapy to restructure thoughts, or even neuromodulation in resistant cases. The goal here is to restart reward and mood circuits. The metaphor of the green light reminds us that with the right intervention, the brain can reboot. It's not a character flaw, it's a biological challenge, and it's solvable. Let's bring it all together. Burnout and depression may look alike on the surface, but they differ in cause, chemistry, and course. Burnout is a system overload. Depression is a system shutdown. Burnout equals change your environment. Depression equals change your internal state. And sometimes it's both. We close with a hopeful message. Whether your brain is spinning out or shutting down, you can rewire it. Recovery is not only possible, it's expected when you align healing with the brain's actual needs. Thank you for watching EQBloom. Be kind to your brain. It's trying to help you even when it doesn't feel like it.